In our HealthCast today, a new surgical approach may help some men who need surgery for prostate cancer. Dr. Alberto Peretti, who's a urologist with Cleveland Clinic West End, says studies have found that a procedure called Retsus sparingly can reduce the risk of post-procedural incontinence.
The space that is located between the bladder and the pelvic bone, okay? So traditionally, when you do a prostatectomy, you go through that approach, and then there are a lot of anatomical structures that you are kind of dividing in order to get access to the prostate, okay? And that is associated with urinary incontinence. Through the Retsus sparing, you attack the prostate from behind, and you leave all these structures in place, so patients become continent sooner than later.
So the doctor goes on to say the procedure requires specialized surgical skills and expertise because it is a bit more complicated and a more difficult procedure. The data from the CDC finds that although life expectancy in the U.S. has not reached pre-COVID levels, it has improved dramatically. According to a report published just today, a 1.1 year increase in 2022 brought overall life expectancy at birth to 77.5 years. The increase comes after the number of deaths caused by COVID-19 dropped. While overall life expectancy did increase, deaths among children ages 1 to 4 has increased 12%, sadly, between 2021 and 2022. And some other new data shows that black people in the hospital are 32% more likely than white patients to have pulse oximeter readings overestimate their oxygen levels by at least 4 percentage points. The devices send light beams right through the skin to estimate your blood oxygen levels and pulse rate, but studies have shown that darker skin tones can block those beams of light. Now, if this kind of device inaccurately shows patients' blood oxygen reading to be higher than they really are, there could be a delay in potentially life-saving treatment.